Hello everyone, and thank you for watching my video. You guys had some really great questions, so we'll just hop to them. Lizzie asked a few questions. She asked first if other cognitive screenings or referrals were made for this patient. And in this case, we didn't perform any screenings or refer for any other cognitive screenings. She didn't necessarily show any signs of cognitive decline, but I do agree that it's never a bad idea to do, and it probably would have been a great thing to do either during the appointment or as a referral. The second question was, due to the age or other comorbidities, do you think it may be likely that a processing issue may be impacting WRS scores? And then she mentions that she has seen dementia affect WRS scores. I really don't believe that dementia is a comorbidity that's causing the WRS scores to progress. She has over time really had a significant drop in her dynamic range. In my opinion, it is more related to the nerve damage. Like I said, she really didn't show any other signs of cognitive decline. We were really positive and optimistic about her chances of being able to get a cochlear implant, and hopefully that would help her. Question by Bree. She agrees that it never feels great when you have to basically say to a patient that you don't have any other options available. And she was wondering what kind of hearing aids we started out with and if we've tried any remote mics or other accessories. I mentioned that this is a tough case, but she really was one of my favorite patients. She was so sweet. Her and her daughter both were really adamant about trying to get the right answer, and they were just the fun couple of people to be around. So in 1988, she did start with a Siemens hearing aid. You can see the model there, but it was only fitted to the right ear. I wasn't quite sure with what the question meant with starting out with, so I assume that the question is regarding what she had started with when I started working with her, and she was wearing a Phonak Naida V90 SP. We did end up giving her, or she had purchased a Roger Select and a Roger 18, and she really didn't feel that they helped her at all. And they were also an expensive investment that she didn't feel that the money was worth what the tools were giving her, so she ended up returning them, and those options really weren't explored just based on her previous experience with accessories. And Dr. Westrick had a couple of questions. Is the CI evaluation being done by another clinic? I believe your clinic is not currently providing CI services. If she gets a CI, would she then have to go to another clinic? So this is kind of a mixed bag because at the time that we had this appointment and saw this patient, no, our clinic was not currently providing CI services, so we did refer out to a clinic in Portland. We welcomed her for any other care that she wanted. If she decided not to pursue the cochlear implant, that she could come back to us. But in this case, I do think that she would have to go and stay and get her care with the clinic in Portland. However, thanks to Lizzie, we are now equipped to provide services for CIs, including the evaluation process. I believe I'm not sure if it's activation or just after activation, and any care that they might need afterwards. It's not quite in full swing yet. We have all of the equipment. We just are preparing to be able to have all of us be able to see these patients. And so we're working on it, but we should by, I believe, January be in full swing. So thank you, Lizzie, for that. Do you think the trans-tympanic gentamicin treatment alleviated her vertigo and tinnitus? That treatment isn't done very often anymore. That is true. And can you explain the purpose of that treatment method for Meniere's? I do believe that this gentamicin treatment had an impact on her vertigo and tinnitus. This is not really a commonly used treatment anymore because of the side effects, which I believe that she probably had some of. She did well from it, but then I think she did end up suffering from some ototoxicity from it over time. But the gentamicin originally was used to assist Meniere's symptoms that were severe or considerably debilitating. It has been proven to be effective, and I included a study that shows improvement after the gentamicin treatment, and they were specifically in vestibular tests of computerized dynamic posturography and VEMS. There are plenty of other studies out there. I saw a couple for tinnitus too. So I do believe that it is helpful, but it is also a very risky drug to use. And I mentioned having serial screenings because in the typical context of this word, it is implied that tones are presented close to within normal limits, and patient either hears it or they don't, and they're referred off for more comprehensive testing if they don't pass the screening. No, that's not what I am referring to. In our clinic, they refer to screenings not just as a pass-fail thing, but as if they come in and they just want to see how their hearing is doing, if it has changed or not. That way, it doesn't have to be a full diagnostic appointment if there's no changes, and then we can just update their hearing aids as needed. Maybe there was a 5 to 10 dB change, nothing too crazy, but anything more than that, we do and have them come back for a diagnostic audio. But so no, but that is what the clinic that I am at calls those appointments, and so that's what I was referring to. It is kind of confusing, I agree. But anyways, that's it. So thank you very much. I hope you all enjoyed my presentation, and happy holidays.